So I would like to welcome everybody, all our participants and speakers this afternoon to the public online meeting organised by the Socialist Equality Party. My name is Max Boddy and I'll be chairing this meeting this afternoon. We do have an important lineup of speakers today who I'll introduce later on, and I do encourage the broadest possible discussion, questions and contributions from everybody participating. Our meeting takes place amidst the greatest worldwide surge of COVID-19 infections since the beginning of the pandemic. In the space of just 2 months, the more transmissible Omicron variant has become dominant across the world, and since November last year, there have been at least 140 million people infected. In terms of global deaths, the Omicron surge is second only to the deadly Delta variant last year. On Monday this past week, the number of excess deaths from Omicron reached a peak of 41,200 per day, according to the international newspaper, The Economist. In Australia, the number of recorded cases is unprecedented. Since January 1st, 2,348,317 cases of the virus have been recorded in this country. Just to put that in perspective, prior to 2022, just below 400,000 cases had been detected since the beginning of the pandemic. That means that in less than a month and a half, more than 9% of the entire population of Australia has been infected. Now, due to the collapse of the testing and contact tracing program, the real case numbers are likely to be several times higher. According to official figures, since January 1st alone, Australia has recorded 2,305 deaths due to COVID. That now means that deaths so far in 2022 have exceeded all the recorded deaths in the previous 2 years combined. Now, with the schools reopened, all the conditions have been made for these figures to soar even further. Now, this catastrophic spread was not inevitable. It is the direct result of the deliberate policies of capitalist governments internationally. Politicians in virtually every country have used the Omicron variant as the catalyst for the scrapping of even the most basic public health measures to slow the spread of the virus. The basis of these outright criminal policies is the misleading claim that Omicron is a milder variant, that the virus will become endemic in society in the near future. This is a lie. The term endemic refers to diseases that are confined to a specific location or population. COVID-19 will never be endemic due to the nature of how the virus spreads. Now, the World Socialist website recently conducted a comprehensive interview with Boston University epidemiologist, Dr. Eleanor Murray, who explained, quote, "The first thing is that a pandemic is an epidemic at a much grander scale. An endemic is not on that spectrum. It is an entirely separate idea. The official World Health Organization and CDC, that's the Center for Disease Control in the United States, definition of a pandemic is a disease spreading out of control in 2 or more regions of the world." So, thinking about that definition, we could ask, is COVID still pandemic? Is it out of control in 2 or more world regions? The answer there is clearly yes. So if the definition of the virus as endemic has no basis in science, then the use of the term is purely for political purposes. The counterpart to this conception is the equally unscientific conception of herd immunity, the idea that somehow letting the virus rip through the population will create natural immunity. These lies are being propagated in order to continue the vast profit accumulation by the wealthy elite and corporations. Lives are to be sacrificed for the profits of the rich. Now, this is the context for the announcement of on February 2nd by the New South Wales Nurse and Midwives Association for a vote on a statewide strike scheduled for February 15th. The union has only called this strike because it could no longer contain the anger and frustration by health workers over their intolerable working conditions. The union has done everything to isolate and contain the strike. Only nurses in the public sector who are members of the union can participate, and it excludes doctors, paramedics, orderlies, cleaners, and other hospital workers, as well as teachers and logistics workers who are likewise forced to work in dangerous and unbearable conditions. The character of the strike is summed up by the fact it does not demand a reversal of the very let-it-rip policies that have caused this crisis. This is because the unions have worked lockstep with the government to ensure such a policy could be carried out. However, the fact that nurses have voted in favour of this strike demonstrates there is strong opposition to the murderous policies of the ruling elite. But this fight must be taken out of the hands of the union. Workers must form rank and file committees to coordinate and link their struggle with workers in other industries, both in Australia and internationally. Now, in March of 2020, the International Committee of the Fourth International, of which the SEP is the Australian section, raised that the pandemic was a trigger event in world history, like that of the assassination of Archduke Ferdinand in 1914, which led to the First World War. Workers were told, as they were being shipped off to the trenches, that it would be all over by Christmas. Instead, the war continued year after year, with the death toll reaching unimaginable numbers. Likewise, the pandemic was not over by Christmas 2020, nor Christmas 2021. Now, a new and deadly phase has been prepared, as even the pretense of defeating the virus has been dropped. But the most important and critical comparison to the First World War is how it was ended. It was the intervention of the international working class that stopped the carnage, most consciously expressed in the Russian Revolution of 1917. Now, the experiences of the pandemic have proven that to bring the crisis to an end, it is not primarily a medical question, but a profoundly political one. Capitalism has demonstrated that it is unable to meet the most basic needs of society, including the prevention of mass infection and death. What is required is the mobilization of a social and political movement of the international working class based on a socialist strategy to bring the pandemic to an end, as well as the capitalist system responsible for its worldwide spread. And with those remarks, I'm very proud to introduce our three speakers today. Our first will be Katie Kinner, a member of the Socialist Equality Party in the US and United States, and a health worker from the US West Coast. Our second speaker will be Jess, an enrolled nurse from southwestern Sydney, New South Wales. And our final speaker will be Cheryl Crisp, the National Secretary of the SEP. After the speakers, we will have time for questions and discussion. Following the Q&A, we will then open for an appeal to our monthly fund, make some announcements for book purchases, and discuss our ongoing campaign against anti-democratic electoral laws. So I'm very proud to introduce our first speaker today, Katie Kinner, who is joining us from the US at, I think it's 9:15 roughly PM in the evening. As I said, Katie is a health worker and a member of the SEP. She is a writer for the World Socialist website and a member of the Rank and File Committee at the Kaiser Permanente in Southern California. This committee was founded in November last year against the calling off of a 32,000 strong strike action of health workers by the United Nurses Association of California and the Union of Healthcare Professionals. The unions then announced they reached a tentative agreement with management, which amounted to a complete sellout. Now, Katie has graciously agreed to speak today before she needs to get some rest, before she starts an early AM shift in the morning. So we very much appreciate that. So I'd like to warmly welcome Katie as our first speaker.
Thank you. Thanks for having me today. It's very exciting to have the chance to collaborate internationally with the struggles of healthcare workers in Australia. And it's also just extremely crucial, that we are collaborating on an international level. The struggle for healthcare workers in New South Wales is identical to the struggle of healthcare workers around the world. We're following your fight and reading interviews, such as the one from New South Wales nurses. And to be honest, the exchange of just a few words, it could be an interview with any nurse across the US. Nurses across the world certainly stand with you in your fight now because it is also our fight. As Max said, I'm a nurse. I'm an oncology nurse, in a major academic medical center in California. The conditions I face in this hospital are likely some of the better in the country, and that is deplorable as my hospital is not safe for workers or patients at the moment. Right now, COVID is surging across the US as it is across the globe. While I don't work on a COVID unit, my coworkers and I are struggling. We are short on basic supplies like normal saline flushes and vacuum containers for blood draws. Our ICUs are so full that in order to free up beds, the ICU is sending our unit patients who under normal circumstances would not be ready for that transfer. This means we are taking care of patients on a regular basis who are extremely unstable and should still be on the ICU. My coworkers and I don't have training for this, and we don't have the time to closely watch vital signs and notice trends before that patient is in a critical situation. We are always scrambling. Being on an oncology unit, most of our patients have extremely weak immune systems. Yet, healthcare workers and visitors are not required to wear N95s, and patients are not tested regularly. On more than one occasion, I have had a patient test positive after they've been on our unit for multiple days, infecting not only their roommate, but other patients as they've been allowed to walk in the halls and use common facilities. When President Biden states that we have to learn to live with the disease or that COVID will become endemic, he is saying that it is okay for these patients to die. Across the US, the medical system is breaking down. Hospitals are full and low on staff. They are forced to close down entire units or departments due to lack of staff. Hospitalization rates across the US are also extremely high. In the first week of February, 80% of all ICU beds in the US were in use. ICU capacity was above 75% in 43 of our 50 states. Research has shown that ICU use at 75% capacity nationwide is associated with an excess death in the tens of thousands. And that data was from the Delta surge. Emergency room wait times are stretched to 20 to 30 hours in some hospitals. Ambulances are being diverted, causing delays in care. Supplies are short, staff is overstressed, and more likely to make medication errors. In some areas hospitals are forcing their staff to work with little to no quarantine period after showing a positive COVID test, as long as the worker is asymptomatic or has, quote, mild symptoms. And mild symptoms, of course, are not clearly defined. In California, the Department of Public Health released emergency guidelines in January, which have now ended, but they did allow infected workers to work without any quarantine for roughly a month. And even in hospitals or states that do not officially allow for sick healthcare workers to work, there are policies in place or a lack of policies in place, such as the ending of COVID sick leave, or the lack of formal and regular testing that essentially push workers back to work while unknowingly or knowingly infected. In complete contrast to the real hospital conditions that I've described throughout the world, capitalist politicians are scrapping all remaining public health measures that slow the spread of COVID. They do this, as Max said, by falsely claiming that the Omicron variant has caused the virus to become endemic or will do so in the future. And the push to define COVID as endemic is manipulating a public health term, and it's completely false and unscientific, and used just to justify all of these mitigation measures. And it falls in line, it's just a continuation of Trump's herd immunity strategy, or not just Trump's, of course, but leading governments across the world. This herd immunity strategy and the lie that the Omicron variant was mild in the first place, which is also incorrect. Democratic governors across the US are beginning a campaign to remove all mask mandates and any other measures that were reestablished during Omicron. In California, Governor Gavin Newsom announced that the state's mask mandate will expire on February 15th. In New York, another Democratic governor announced that the state will end its mask mandate in its move to make COVID endemic, deciding to treat it as if it is the flu. New Jersey, Delaware, Connecticut, Massachusetts, and other Democratic-led states have lifted their mask mandates. Dozens of other states have ended contact tracing, and on a national level, the US has has officially stopped reporting COVID deaths and hospitalizations on a federal level. This homicidal strategy is embraced by President Joe Biden and other world leaders who previously upheld at least a pretense of seeking to end the pandemic. Now, under the guise of a pseudoscientific endemic strategy, the ruling class can push all workers back to work, all students back to school, maintain profits, and save their stock portfolios. This opens the world up to the development of new variants, waves of increased hospitalizations, and countless more entirely preventable deaths. This is not why we went into nursing or healthcare. Other healthcare workers, as well as myself, went into the field to care for people in their most vulnerable moments of life. For me, as they struggle with a new diagnosis, prepare to begin chemotherapy, and have conversations about end of life. I also went into nursing to care for people who can't speak for themselves, elderly patients with dementia who must be checked on frequently, fed their meals, turned every 2 hours, kept company when their family cannot visit. Even before COVID, the conditions under which we work make it difficult or impossible to properly care for your patients. You seek to care for your patients in a way that you would care for your own family. And when you aren't able to provide this kind of care, it wears on you on a deep emotional level. It cannot be stressed enough that the despicable situation within the hospitals has been rubber stamped by nurses' unions. This must be seen as a warning to Australian nurses that the fight for safe staffing and safer working conditions for yourself and your patients must be an independent fight outside of the nurses' union. Lessons must be drawn from these experiences, and I'd like to share some of these experiences as I close up with some of these struggles we've had in the US. This past October, over 30,000 nurses in Southern California at Kaiser Permanente, which is a huge healthcare conglomerate here, nurses there voted by 96% for strike action, and they were prepared and ready to fight. When the strike date was finally announced, nurses were ready, yet less than 24 hours later, 24 hours before, there was a rotten tentative agreement that was hastily worked out between the hospital and the union, calling off the strike. And the tentative agreement contained real wage cuts and did nothing to improve staffing levels. In the lead up to the vote, the union aggressively censored discussion of the contract on its social media pages. The final voting period was rushed to only 2 days. Early on in the struggle, Kaiser workers, with the guidance of the World Socialist website, formed an independent rank and file committee to fight outside of the confines of the union bureaucracy. We in the Kaiser Workers Rank and File Committee formulated our own list of demands, wrote statements opposing censorship of material that questioned and opposed the union, held regular meetings, exposed the close partnership between hospital management and Kaiser's union, and fought to coordinate with workers across all industries for a broad scientific elimination strategy for COVID. Another major struggle took place at St. Vincent Hospital in Massachusetts on the East Coast when 700 nurses were on strike for 9 months this year. The hospital union, the Massachusetts Nurses Association, never paid a cent of strike pay to these workers who they supposedly represented. Instead, the nurses set up a Venmo account where people were encouraged to donate for nurses to be able to afford necessities. The MNA did nothing to mobilize its statewide membership of 23,000, purposely sabotaged the strike, isolating and starving the workers, forcing through a sellout contract that does nothing to address staffing or falling wages. These are only 2 examples of healthcare workers' strike action in the US. We're seeing an explosion of opposition brewing for years before the onset of the pandemic to the continuous overwork in unsafe conditions. I want to be here to share these experiences so they can also become your experiences and help you in your fight. The aim of the trade unions, the NSW, NMA included, is to push any mass opposition back behind safe channels, to quell the emergence of a political movement of the working class against the governments and parties responsible not only for the catastrophic loss of lives during COVID, but also for the decades-long underfunding and gutting of public health and healthcare resources that left workers unprepared for this pandemic. This is why this meeting and the formation of rank and file committees are so crucial. Workers are tired of mass death, of disruptions to their lives caused by the constant threat of infection by this deadly disease. Healthcare workers, along with the entire working class, are fighting back and must do so together in lockstep internationally as we fight for our patients' lives and the very right to life, which is bound up with the need to fight for the global elimination of this virus. Thank you again for having me at this meeting. Healthcare workers in the US are following your struggle very closely, and we are prepared to help in any way that we can.
Thank you very much, Katie, for those remarks. I think for anyone listening, one would draw the universality of the experiences of nurses, whether it be the lack of resources or conscious infection, or the role of the unions in isolating and starving out workers and organising sellout deals. And I think the point on the unifying struggles of workers internationally is really critical. Now, to continue this discussion, our next speaker will be Jess, an enrolled nurse from southwestern Sydney, who will speak on the conditions facing nurses and health workers and her experiences. She has just come off a shift at her hospital just before our meeting started. So again, it's much appreciated, and I do welcome Jess to our meeting today.
Hey everyone, my name's Jess. I'm an enrolled nurse currently working in a major southwestern Sydney hospital in a surgical unit, and I would just like to touch on the conditions that nurses have been facing prior to COVID and also currently. Majority of shifts we are working short, either 1 or 2 nurses down. If they are replaced, most often they are replaced with assistant nurses who can essentially only perform patient care, causing the workload for registered nurses and enrolled nurses to be unmanageable. Recently, my boss told us that the model of care will potentially be changing, which means that the priorities of doing personal care will change. Although this was not implemented, it was definitely on the cards. We are pressured by a management team to perform overtime, and if we decline, we are guilt-tripped by stating we are letting our fellow nurses work short-staffed. We are called from the after-hours office saying if you don't find another staff member, you will not get anyone else. So we are now being told to fill shift shortages. Our hospital had not been a COVID hospital at all until Omicron. At the peak of Omicron cases, because the allocated COVID hospitals were overrun with patients, they made other hospitals COVID hospitals. Mine established COVID positive wards, causing COVID negative patients to be transferred out of their specialty wards and into general wards, which did not cater for their specific illness or surgeries. In my hospital, there were 5 COVID positive wards established with around 28 to 30 patients in each ward. All those wards had specialties such as geriatrics, orthopedics, medical, and upper gastrointestinal. The COVID negative patients had to be transferred to other wards or discharged. Around 140 patients were shipped to other wards to cater for the positive COVID cases, which the hospital was now accepting. During the transfers, I saw patients queued up in the corridors awaiting beds, as they either were none available or management were waiting on confirmed discharges to leave. That I have never seen before, and it was definitely a shock to see. If a medical emergency occurred, there is no equipment available for those patients. All the nurses were shocked. During the peak of COVID cases, and still now, close contact isolation rules are forever changing. This occurred due to the fact management were unable to fill positions of nurses who were isolating because they were positive or close contacts. One day they outlined a set of rules, and the next shift you would come into, it would have changed again. Up until last week, the ward I worked in deployed clinical nurse consultants, physiotherapists, and occupational therapists who all have their own roles and workloads to fulfill, who had to come into the ward during morning rush to assist nurses with patient care, such as showering, dispensing meals, and walking and sitting with patients, just so nurses can provide the essential care to patients, which is medication administration, complex patient care, or orders directed by the medical teams. We are wearing PPE such as N95 masks, goggles and shields, and gowns at times, meaning we can't drink water or go to the bathroom during shifts as we cannot break PPE on ward. Currently, the ward I work on is a general surgical unit, meaning we cater for pre and post-operative patients, specialising in urology and colorectal, although it's not limited to. Now we are taking on patients who are COVID positive, but who have come into the hospital for health reasons fitting under our specialty scope. This is a recipe for spreading the virus to other patients. Nursing ratios are supposed to be 4:1. That's 4 patients to 1 nurse. In my 3 years of nursing, I could count on 2 hands when that ratio has been met. New graduates and junior nurses who are developing their skills are expected to jump from university and take on the responsibility of looking after 5 to 6 and at times 7 patients. And if you're in a high acuity ward, it can potentially be disastrous for both nurse and patient. My manager told us in a meeting that there will be times you will have 4 staff with 28 patients. The long hours, the lack of support from management team, and the minimum nurse to patient ratios not being met is severely damaging patient outcomes as well as nurses' mental health. I have seen many senior nurses retire or quit due to these conditions, and I'm sure there will be a lot more to come. Either senior nurses, new grads, or junior nurses leave the industry as they cannot manage. This is some of the reasons why nurses are striking on the 15th of February, which I'll be supporting. Thank you.
Thank you very much, Jess, for your important and helpful contribution. I think, as one commenter has made clear, I mean, it really does paint a picture of a dystopian situation of intolerable conditions for nurses in New South Wales. But this is certainly repeated again and again across the country, and as Katie went through, really internationally. So with that, I do want to introduce our final speaker today, which will be Cheryl Crisp. Comrade Cheryl is the National Secretary of the Socialist Equality Party in Australia and a writer for the World Socialist website. So welcome, Cheryl.
Thanks, Max. And I'd like to welcome everybody to the meeting, and also thank Katie and Jess for their remarks, which I agree with Max. They're very compelling and quite confronting. Of course, New South Wales nurses in public hospitals have voted overwhelmingly for strike action in response to the unsustainable and really intolerable working conditions and grossly inadequate pay rates that they have endured under now for decades. These conditions have been exacerbated by COVID-19. The media has certainly made much of the fact that this is the first statewide nurses' strike since 2013. And there is, without a doubt, a great fear that this action could provide a springboard for other sections of health workers, as well as the working class more broadly, to undertake industrial action. In fact, the Australian Paramedics Association has just announced a survey of paramedics to strike on February the 17th, 2 days after the nurses. And of course, paramedics are rightly asking why the action wasn't taken with nurses, with New South Wales nurses. As Katie and Jess have explained, whether it's in California, New South Wales, Britain, Sri Lanka, it doesn't matter where it is. The experiences of nurses, of health workers are really identical. And it's very difficult to really establish a sense of the catastrophe which has been inflicted on the working class internationally, but also the population of this country, unless one really looks at the figures. And of course, those figures are now increasingly difficult to obtain, to access, and they're being downplayed and underreported. 4,544 people have died of COVID since the beginning of the pandemic in Australia. It took 18 months for the first 1,000 people to die. It has taken 2 weeks for the last 1,000. Prior to the Delta outbreak, which developed in June of 2021 in New South Wales and then spread, Australia had recorded 910 deaths. 90% of those were the result of the second wave of the virus in Victoria between July and October 2020. That figure then remained static for almost 9 months. In the Delta outbreak of June to December 2021, more than 1,200 people died. Since December 15th, which the New South Wales Liberal Premier dubbed Freedom Day, another 2,411 people have died. So double the number of people have died in the 3 months since Freedom Day than died in the previous 6 months, and more than 4.5 times the number since October 2020. The emergence of Omicron, which won't be the last or the final variant, was the occasion for the Morrison government, as it was for Johnson in the United Kingdom, Biden in the United States, and really every other country, to declare that the virus was now too infectious to be controlled. It couldn't be prevented from spreading, so not only should it be allowed to spread, but it was encouraged to do so. This was on the basis that mass infection of the population would provide herd immunity, something which has been proven to be entirely false. But of course, the other aspect is what price was to be paid for this policy of herd immunity in infections, illnesses, and death. The Chief Medical Officer in Australia, Paul Kelly, declared that the so-called mild variant of Omicron and its widespread throughout the population would be, quote, the best Christmas present he could wish for. Well, he got his wish. There have now been almost 3 million cases of COVID-19 in Australia. 2.4 million of them have been recorded since January the 1st, 2022. So in 43 days, there has been an average of 57,737 infections per day. Prior to January the 1st, the daily average of infections in that previous 21 months was 560 infections a day. So as Max and the other speakers have outlined, this is not a natural disaster. This was not an unpredictable crisis. All these people, along with the almost 6 million who have officially perished around the world, and really the likely 21 million, if excess deaths are factored in, have died unnecessarily. They have not died because of the characteristics of the virus, but because governments in virtually every country have made decisions that production and profit was to be prioritised over health and lives. Measures in Australia, New Zealand, and China have proven that even before vaccines were available, that public health measures can eliminate the virus. But the demand of corporate interests, both national and internationally, was that no longer could any measures be tolerated that would impede production and business. The reopening of schools, which has been demanded throughout the world and in this country as well, has nothing to do with the education of little children or the concerns about their mental health. It has everything to do with forcing their parents back into workplaces and factories. This is a world crisis on a scale of magnitude not seen in the lifetime of anyone living today, and really only comparable to that of the 2 world wars. The experiences of nurses, health workers, teachers, warehouse workers, in fact, all workers in this country are identical to those in the United States, Brazil, Europe, and elsewhere. Nothing is going to be permitted to stand in the way of the accumulation of wealth, increased productivity, intolerable workloads, continuous risk of infection, illness, and possible death is the new normal. The outcome has been seen both in Australia and internationally, with unprecedented levels of inequality reported in an Oxfam report released in January. While infections, illness, and death was inflicted on ordinary people, the bank accounts of the super rich rose faster than ever before. Just some of the figures that the Oxfam report highlighted. The 10 richest billionaires globally doubled their wealth in the course of the pandemic, from $700 billion to $1.5 trillion, at a rate of $15,000 per second, or $1.3 billion a day during the first 2 years of the pandemic. If they lost 99.999% of their wealth tomorrow, they would still be richer than 99% of all the people on the planet. These 10 richest billionaires have 6 times more wealth than the poorest 3.1 billion people. A new billionaire was minted every 26 hours since the pandemic began, and inequality contributes to the death of 1 person for every 4 seconds. And if you thought that the situation in Australia was any different, that would be a very serious error. The Australian nation's 47 billionaires doubled their wealth to $255 billion at a rate of $2,376 per second, or more than $205 million a day. These 47 richest individuals have more wealth than the poorest 30% of the country's population, that is 7.7 million. But there is actually also another experience which is an international one, and that is the role of the unions. In every country, the unions which have played the role of enforcer and policeman, either of government department demands or of the requirements of private corporations. And they have played this role for more than 3 decades. As I said, while it is true that it has been almost 10 years, really not since 2013, that New South Wales nurses have taken statewide strike action, what isn't discussed is that the 2013 action was over exactly the same demands as today: patient-nurse ratios and the pay freeze, which had been inflicted on all public servants really more than 9 years ago. So nothing has been resolved, nothing has changed since that action, except that it has gotten worse. Every nurse that we speak to say that while the situation is impossible now, in fact, it is not substantially different to what existed prior to the pandemic. As Jess said, there weren't workable or even legal staff-patient ratios before COVID. But what has the New South Wales Nurses and Midwives Association done about that? They have posted campaigns on their Facebook page. But other than that, there has been no fight, no mobilisation of nurses or any other healthcare workers in that regard. And if one looks at the graphs of funding, it's not hard to see why. The funding graphs show that New South Wales and Victoria have the lowest per person health expenditure of all the states. In fact, Australian health expenditure has not kept up with inflation, and this was only up until 2019-2020. So inflation has now increased, which means that under conditions of an ageing population and increasingly complex medical needs, it is the staff, and in particular nurses and other healthcare workers, who are forced to make up for the shortfall in funding. Last year, nurses took action in New South Wales over staffing, but it was divided, it was isolated from each other, it lasted 1 or 2 days, not on the same day. And in fact, many nurses didn't even know whether or where other nurses were taking industrial action. It was designed, which quite bluntly, so is the situation for Tuesday's strike, to let off steam. There is not a union that has opposed the reopening program of either Dominic Perrottet in New South Wales or Daniel Andrews in Victoria or the Morrison government federally. They have all marched in lockstep throughout the entire period of the pandemic. In fact, Health Services Union Secretary Gerard Haynes welcomed the decision by New South Wales Liberal government to slash the isolation time for health workers from 2 weeks to 7 days, provided they returned a negative PCR test. At a protest of aged care workers on Tuesday at Parliament House, Michelle O'Neill, the Australian Council of Trade Union president, told workers, quote, "The whole union movement stands with you," end quote. "I give you fair warning. When you hear that, I say beware. When the ACTU declares it stands with workers, you know you're about to be sold out." That is exactly what has happened to workers who took strike action in 2021, the Coles, Smeaton Grange workers, the warehouse workers, the General Mills plant workers in Sydney, and McCormack's workers production facility in Melbourne. The ACTU has played the most abhorrent role since the outbreak of the pandemic, first by working hand in glove with the government to design the greatest transfer of wealth from the government to big business and major corporations through the bailout packages of 2020. Having done that, they rushed through deals to cut pay and conditions so that employers could fully exploit the handouts and herd as many of their employees back to work as possible, regardless of the dangers of exposure to COVID-19. Penalty rates and set working hours were dispensed with to ensure employers could make maximum use of the crisis which COVID afforded them. But what has to be understood is that the role of the unions has not transformed during the pandemic. It has deepened, it has degenerated, but it has not transformed. The unions, and in fact all national-based organisations such as the Labor Party, have been transformed over the past 40 years into the enforcers of the demands of business and the capitalist class against the working class. Their role is not the result of just corrupt and cowardly leaders, although that exists in abundance, but it is the result of the very nature of the unions themselves. Their existence has been to extract better conditions for workers from the capitalist class. Their existence, therefore, is dependent on their relationship with the capitalist class. While national economies were able to afford some crumbs and reforms, the unions appeared to both represent and benefit workers, although any gains that were made were through the bitter struggle of the working class itself. But with the growing crisis of the world economy, which became acute in the 1980s, the unions themselves transformed from having any connection and interest in the conditions of their members to becoming a police force which ensured not the benefit of workers, but the profit levels of employers and business. Their role is to suppress, isolate, divide workers, and to make sure they do not break free of the grip of the unions. In Australia, there is an entire state apparatus where the very rights of workers to defend themselves, to take strike action, to maintain livable wage levels, to ensure the safety of their work conditions is completely tied up to the courts and the state apparatus. The program of arbitration and fair work was not the brainchild, however, of the Liberals, but of Labor governments, beginning with the Hawke-Keating Labor governments of 1983 to 96, then followed by the Rudd and Gillard Labor governments. So while nurses have voted overwhelmingly and without ambiguity for strike action on Tuesday. Different hospitals will strike for different time periods and at different times. But Brett Holmes, the Secretary of the New South Wales Nurses and Midwives Association, has already raised that it has to be sanctioned by the New South Wales Industrial Relations Commission. And so with that in mind, there is a compulsory conference scheduled for 10 a.m. on Monday between the union and the Ministry of Health. Be warned, every effort is going to be made to ensure that this action does not go ahead. There is untold fear that this will become a trigger for action by broader sections of workers. So the pandemic has only highlighted and most starkly exposed the role of these organisations. But it hasn't just exposed them, it has exposed the entire capitalist system. This is a system which cannot and will not ensure life and health of the population. So why should we think that capitalist governments would not go to war to both resolve their own geopolitical and strategic crisis and also to try to divert the population from the criminal decisions that it has made in every country? They have shown that they are more than willing for millions of people to die from a pandemic that was avoidable. And it will do so in the interests of corporate profit to go to war if that is necessary. So the crisis of the pandemic is not just a medical crisis, but it is a profoundly political one. Unless workers take matters into their own hands to institute the necessary measures to end the pandemic, the death toll will rise and it will continue interminably. Variant after variant will arise to ensure that. When we talk about the necessity of workers to take matters into their own hands, we mean the development of independent organisations, rank and file committees that are separate from, opposed to the unions and the role that they carry out, and also opposed to and separate from Labor, from the Greens and these other political tendencies whose role it has been to prop up capitalism in its hour of need. An election in this country is imminent. In fact, if it does go ahead, it will have to go ahead before May. Both major parties and all the other parties in Parliament have supported and imposed the measures which have led to this disaster. What this election will do and decide is not who will fight for the interests of nurses, health staff, and all sections of the working class, but which party will be best placed to enforce the pro-business restructuring that the ruling elite insists must accompany the reopening. The unions will say that the crisis can be resolved by voting for Labor. Nothing could be further from the truth. Labor was in office for more than 20 years in New South Wales as the hospital system deteriorated and spearheaded attacks on health at the federal level, including the NDIS. Now they have dispensed with even the phony populist rhetoric that they took into the 2019 election about limiting inequality through taxation. Whether Morrison is removed in a palace coup or loses the election with Labor coming to power, nothing will be resolved for the working class. Only by a conscious turn by workers to fight for their own independent interests through organisations independent of the unions and Labor can there be a realisation of the strength and power of the working class. The SEP fights for workers to form rank and file committees in order to develop their own dialogue, their own relationships, their own interaction, to be able to establish knowledge and discussion with workers in their own industries, in their own neighbourhoods, and throughout the world. Our movement has initiated the Global Workers' Inquest into the pandemic. We have done that because what the working class has to know is the truth about how this pandemic and this catastrophe has been inflicted upon the world's population. Knowledge, information is revolutionary. That is why the ruling class, the media, and their acolytes in the unions, the Democratic Party, the Labor Party, maintain a conspiracy of silence against the information which is so necessary for ordinary people. The inquest has already secured invaluable testimony from renowned epidemiologists and scientists, as well as nurses, auto workers, and ordinary people about their experiences. We will reveal how the pandemic began, how it spreads, and why it continues and accelerates today. We will also present the evidence on how the pandemic can be stopped, because it can be stopped. It will require enormous resources, but as the Oxfam report has highlighted, those resources exist. The issue is in whose hands they reside. What we have to ensure, what the working class has to ensure, is that the resources which are now controlled by the infinitesimally small layer of the ultra-rich are taken from them and put at the disposal of society as a whole. It is possible to eliminate and eradicate the pandemic. That has been proven, but it requires the working class to undertake those measures, to do it on an international scale, and only if that is carried out can these deaths be stopped. But that requires an alternative perspective. It requires an international perspective, and one in which all the other political parties, in opposition to all the other political parties. So what it requires is a socialist perspective. I thank you for your attention and welcome any questions and discussion.
Well, thank you, Comrade Cheryl, for your report. And thank you again to Katie and Jess for their contributions. We now will open up for questions and discussion. Just in particular, as I mentioned before, Katie does has some limited time with us today. So any questions that are directed specifically for Katie, we will prioritise. But actually, any questions at all on any of the reports and contributions will be welcome. We can also call on people from the floor if they'd like to speak. But whilst you are thinking of some questions to put in the chat, as I said, to get into the chat, you use the button with the speech bubble above it. And to raise your hand, you can see it next to, I believe, yeah, right next to that. You can raise your hand. But there have been some comments already that have come through that are really important, I think, and will add to the discussion. There's a comment by Christine that says, yes, and hopefully action in aged care will happen soon. Pay rise would be good. I get $24 an hour and I work 1 day a week in my old job in retail, that's ladies fashion. And I get $5 an hour more than aged care. No wonder everyone is leaving. No one will be left in a few years. No one will be left in a few years to look after the growing aged population. Everyone is tired and fed up with conditions, and so am I. There are also comments, quotes from Gillian, from G. Steiner, help with definition. Barbarism and political savagery are endemic in human affairs. There's some other quotes she's put in. El Namia, hurricanes and slave troubles were endemic in the West Indies. There's some other contributions, so I'm just getting to them. There's been a lot of important discussion in the chat, and I will really encourage people to speak and to ask questions. As I said, it's a very important opportunity to be able to ask questions of Katie from the US, as well as Jess, a nurse enrolled nurse in Sydney. There are contributions also from Mary, who speaks on her experience. All staff and visitors to the hospital I work at are given surgical masks. The only N95 masks to be used in surgical wards, only N95 masks are used in surgical wards. I have to buy my own supply to work. Also, Perrottet declared no further restrictions to visitors for palliative patients, but the hospital already had a policy of giving exemptions to visitors of palliative patients. This change will put further pressure on nurses, as visitors, although monitored, bring a risk of infection into the hospital with them. Most nurses are casually employed. Many older nurses, formerly retired, have been asked to come back into work to meet the demand. They're always short-staffed wards. The hospitals had to shut down one ward completely due to lack of staff. This is in Northern Rivers of New South Wales. There is also a few comments by Tammy, who I think in that sense, contravening our discussion on the union, said the New South Wales NMA, and that's the Nurses and Midwives Association, is standing for nurses and midwives because that is who they represent, and not because they're against other health professionals. It is up to the other unions to stand with them, or as the paramedics are doing, hopefully creating a rolling strike that will have more power. Sorry, there was another point that's raised by Tammy on the question of, nurses and midwives are being bullied by employers and governments, etc., since the pandemic like never before, in a link. So there are many, many comments. So far, there's no direct questions that have come through. As I said, I think you should really consider asking some questions of any questions at all. But there is one question, and I see that there's I'll call that in a sec, but the first question is from Michael. How do nurses and healthcare workers feel when Biden in the US or Perrottet in New South Wales claim that everything is fine?
Yeah, I can start answering that. I mean, I think both of our comments have kind of addressed this a little bit, but it's completely sort of laughable. I mean, it's horrific. So laughable is certainly the wrong word, but there's this sense that we're sort of shouting into a void, that this is just not acceptable, the conditions we're working under. Meanwhile, you see sort of people out and about at the stores, at restaurants, acting as if everything is fine. And I think that's the important issue, is that this isn't individuals, workers' faults who are being sort of told from the government that they're allowed to, that it's safe. There's been so much misinformation about this, and it's resulted in many people not understanding the crisis to the full extent and not experiencing it in the healthcare facilities. I think there is a certain just defeated feeling among a lot of nurses, which will change as these struggles grow and workers see what's happening around the world and actions that are being taken by healthcare workers across the world. But there is a certain element of just, I guess this is how this is now, or sort of ignoring it themselves, ignoring the sort of severity of it. The hospitals also kind of, healthcare workers are scrambling, but at the same time, in the US at least, and specifically in the hospital I work at, there's also this kind of move to almost not bring it up, act as if this is a normal shift and a normal time period, except that we're all wearing masks. In nurse, we call them in the US, I'm not sure what you call them there, the sort of pre-shift and post-shift meetings, we call them huddles. And at huddles, especially as Omicron was beginning, and then even now, I mean, it's rare that even the word COVID is mentioned. And we're just supposed to sort of expect to do our jobs while there's a deadly virus in the air and our patients have no immune systems. So I don't know if that really answers the question in full, but that's what I would add.
Thanks, Katie. Jess, did you want to add anything to to the discussion or on this question? As I said, it's, what is the reaction by healthcare workers when Perrottet, particularly in New South Wales, just says everything is fine?
I mean, it's essentially really what Katie said. It's quite delusional and it's just not happening. We're not coping in the hospitals, and I would like to see one of them come into the hospital and do an 8-hour shift and then come out of it saying that they're coping. But yeah, it's very delusional and it's not happening,
There are some other questions now coming in for Katie and others. I do think that, as I said, I'll be prioritising the questions for Katie. There is one from Keo. Thank you to Katie, Jess and Cheryl. Katie, what has been the response by workers to the building of your rank and file committee? How has the union responded to the committee?
Sure, good question. I mean, first, I think there were many workers who actually had not thought as much about the role of their trade unions until this event. Many were younger nurses who sort of hadn't experienced this before, and some were older nurses who, for the most part, they felt that their union was they didn't expect much out of it, but was perhaps doing something, they believed. And then this event really sort of turned a lot of people and really there was a lot of anger among nurses. We would find many nurses and sort of speak to them through Facebook, and we'd find them on the group chat for the union the union Facebook page, in which these workers were furious at their union officials. How could you accept this contract? This is a complete joke. And sort of trying to expose what had happened. And they were just censored from the page, their comments deleted. If they shared articles from the World Socialist website, they would be deleted. And so many of these workers would became curious, about our perspective about the unions and had more questions. And we, we're always discussing kind of the role of the trade unions more broadly, not just in healthcare, of course. And so the response was very favorable, although of course there were questions at first and sort of discussions on the role of the trade unions. But this experience really sort of radicalized a lot of nurses. Now with the Kaiser workers rank and file committee was primarily active, sort of surrounding the strike vote and the contract vote. And while we aren't quite as active anymore, because it's been several months and many of these healthcare workers are feeling kind of defeated, but that's sort of changing, as we send them articles about struggles across the world. So it's important that these discussions occur, and many of these workers actually, or not many, but a few worked together in the same hospital but had never met. So it was kind of an important opportunity to be really also trying to push with a lot of the Kaiser workers in the rank and file committee that we don't have sort of 4 more years to wait until another contract. We barely have 4 weeks. Who knows what variant will come next? And that the time to continue to fight for this is now. So it's a struggle always to work out, what is the right direction. With these for the workers to figure out what the right direction to head in is. But I think more and more these experiences that they have gone through have pushed them to realize that they need to be working outside the confines of their unions. And sorry, I keep saying their unions. They're not their unions. They're the hospital's unions. So that's all in my comments there.
Thanks, Katie. There are numbers of points and questions coming in. I am trying to get through the chat. I won't actually be able to read out every comment, is also due to the volume. But there is a question, I think, flowing from what you were raising, Katie, from Gillian, who said, shocked. How did such an essential industry or sort of employment get casualised? When did it stop being a life's proud career you had trained and qualified for? There's also, and perhaps you could look to answer that, Katie, but while you do, I'll just read some other comments. There's one from Dolores just on the conditions she faced. My mother is in a difficult situation with her health. Multiple melanoma has been slowly returning because she spent a long while without treatment, and I'm deeply concerned about the state of the hospital system and the impact it will have on her health. However, I am very grateful to staff and nurses who have been doing their best in treating mum. I mean, there's another one from Yvette. Feels like capitalism is morphing into a dictatorship / fascism. That's been, responded in the affirmative by others. I think there's one from Robert from Germany who says, European cities will soon be facing rabid protests from hordes of highly organised anti-vaxxers. Is it worth taking to these mind-locked people or to those in my village tolerating them? In Germany, the stench of fascism is definitely in the air again. I mean, that's something that maybe can be addressed by the speakers as well. The question of the role of these anti-vax protests, which have certainly erupted and taken new form or developed form in the course of these convoys, which are certainly being utilised to transform the political discussion, turn it even further to the right. Are there any points that our speakers want to make on some of the questions and comments that have come up so far? Oh, there's one I missed, sorry. And I do think this is important, trying to scroll through them all. I do apologise, but from Pietra, who is a school teacher, or at least works at a school, I think, and again, this shows the universality of the experiences that workers are going through. He says, there's no discussion at my school. The Federation are having an election for the representative at my school this Wednesday, and I'm trying to raise the importance of knowledge and information. I'm considering standing for the role of rep, if only to raise the profile of the CFPE, that's our Committee for Public Education, and the World Socialist website. But the ability to raise issues at my workplace is very difficult. Makes another point later on. The same process of casualisation that Gillian was so shocked about has swept across education in Australia, and that is true both of high school education as well as tertiary education in the course of the universities and campuses, which are also being forced back on the job.
I'll deal with the question. I'm sorry, I don't know who on these protests that have developed over the past period, and the comment that it appears that fascism is developing. I mean, in that sense, it's not an appearance, but it is also something which we need to be very mindful of and understand what the source of it is. Certainly January the 6th and the attempted coup in the United States by Trump supporters was an attempt to install and overturn the election, the 2020 election, the attempt by Trump to disenfranchise millions and millions of American workers and to install himself in a dictatorial position as president, a completely unelected president. And this is certainly in the heartland of bourgeois democracy, a profound shift which has taken place. These forces whose political perspective, in that sense, the underlying demands which they put forward, whether it is in the United States, in Canada, the ones in Australia, the ones that have developed in New Zealand, they were all based upon opposition to lockdowns, to vaccination mandates, to any measures, any mitigating measures that would stop the spread of the virus. If one looks at the testimony that that has been given in the investigation into January 6th, this was the uniting factor. This was what they put forward. And of course, the fact that there were entire layers in the Republican Party who supported them, who organised with them, and who have now increasingly transformed the Republican Party into a fascistic organisation, is because preparations are certainly being organised to undertake the implementation of these measures against the population and against the working class. But I think that the element that we have highlighted, certainly in the analysis on the World Socialist website, is that it is not the strength of these forces. I mean, these are, the most disoriented, disaffected dregs, really, political dregs of society. These do not represent the vast majority of either American workers or Australian or Canadian. But what is it that allows them to have a presence and an influence far beyond their numbers or the political program which they put forward? It is because of the suppression of the movement of the working class, which is particularly the responsibility of the Labor Party here, the Stalinist parties, the unions, the Democratic Party in the United States. These organisations would not see the light of day under conditions of a mass movement of the working class, and a movement of the working class with a clear political perspective. And I think it's a lesson which has to be developed and really understood. The ability of the Nazis to take power in 1933 in Germany was not because of the strength of Hitler, his program, or the fascist thugs within the SS or the SA. It was because of the completely wrong political perspective which the Communist Party of Germany put forward, the Comintern undertook, in which the unification of the working class against the fascists was rejected for a policy which put forward first fascism, then us, that the Social Democrats were in fact social fascists, which they were not. The working class in the social democratic organisations in Germany were not. But that allowed Hitler to walk through the middle, to go in, to be installed by the German ruling class as Chancellor on January the 30th, 1933, without a shot being fired. Those lessons, those historical lessons of the experiences of the working class have to become part and parcel of the DNA of the understanding of the working class internationally today, or the same sort of catastrophe could befall the working class in this period. These forces, I mean, certainly in Canada, in the United States, throughout, I mean, you've got the Proud Boys. These are outright fascist forces who are present, who are organising many of these layers. It is a movement of the working class that will defeat them. And that's what has to be understood. And that's why workers have to break free of the constraints of the old organisations that fear a movement of workers far more than they fear the fascists. I mean, the Democratic Party, under conditions where its own members faced possible kidnapping and execution on January the 6th, continually, as they say, you know, reach their hand out across the aisle to our Republican friends. They are far more concerned with maintaining the two-party system in the United States than allowing or allowing a movement of the working class to develop out of the grip of either the AFL-CIO, the unions, or the Democratic Party. The same situation exists here. These forces in Canberra are the dregs of society. But you know, what is it that allows them to get a hearing is because the working class is not yet started to move. That's why workers have got to break free of the constraints of the unions, of the Labor Party, and develop their own independent political program and perspective. And that is a socialist perspective. It is the Trotskyist movement, as it was in 1933, that put forward the necessary political perspective for the unification of the working class against fascism, against the Nazis. Again, it is the International Committee, it is the Trotskyist movement today that fights for a political program and perspective that will fight to mobilise the working class on an international scale, both against these forces and against the drive to war, and of course against to end the pandemic.
Thanks, Cheryl. Look, there are many comments coming in, and there are people who are indicating to speak, and we will take more discussion. And if I'm not getting to your comment or question, I will. But I'm conscious that Katie will need to leave to prepare for work soon. There is one question that has come through for her, which before she goes, she would like to answer, which was a question from Frank. Katie, do you have a grip on any difference between privatised hospitals and public hospitals in the way they treat the workers and the accessibility of resources?
Yes, I can work on answering that question, and then I'd like to say something more briefly about the Kaiser rank and file committee as well. Definitely, there is a large difference. I mean, not even between the public and private hospitals, but also simply the location in the U.S. As well as many other factors. I mean, for example, nowhere, of course, are the conditions good. Like I said, the hospital I work at is a sort of well-funded academic hospital, which has some of the better conditions. But again, that's nothing to be proud of. I think in California, there are actually legal ratios which are not followed. There's always some way to kind of get around them, but it is, again, in other locations, the ratios are much worse in other parts of the U.S. Rural areas of the country, as I'm sure is similar in Australia, suffer significantly with really horribly low staffing levels. I know I've seen and I saw an article from a rural hospital where doctors were actually going on Facebook to search for other physicians that might have open beds at their facilities to take patients as they became more and more ill and could no longer be cared for at a sort of more local community hospital. Another major difference between a public community hospital and a larger academic private hospital would be just the resources. At the hospital I work at, there is a reliable person who comes around to draw the labs. There's a respiratory therapist who does the breathing treatments. There's many resources all around you, whereas at a community hospital, they are dumping more and more responsibilities on the nurses. And this happens in all hospitals, of course, but with the even worse resources, you suddenly have become the person giving the vaccines, as well as cleaning the patient if there's no nursing assistance. as well as drawing the blood, as well as walking it to the lab. If there's no technicians to carry the blood that needs to go to the lab. So just sort of endless responsibilities get added to the shoulders of nurses and other healthcare workers as well. So those are some of the major differences. But again, as we've discussed, the overall sort of experience of many workers has been the same internationally. The sort of working conditions might vary, but the sentiment and the experience is very similar. Lastly, just on Kaiser, I do want to say, briefly that something that really came up in our Kaiser meetings that I wanted to share that I realized I didn't mention in the last answer that I gave was that it became clear when having all the nurses together speaking that the fight at Kaiser was inseparable from the fight against the pandemic as a whole. Quickly, the question was raised by someone, okay, so what do we need? What do we need to get through the Omicron surge? And what do we need to have safe staffing? And one of the nurses stated that, well, it's too late now. And that wasn't sort of a defeatist statement, but just to say that weeks had already passed since Omicron had entered the country, and there was nothing that we could do to fix the hospital staffing in that exact moment. What was needed was an all-out and aggressive scientific-based campaign for the elimination of the virus. Stopping it at the doors of the hospital, is not a sustainable strategy. So that's all I just wanted to add about our Kaiser work, and it was a very powerful experience and continues to be as we continue to work with workers at Kaiser, not just in California, but we want to sort of expand our work with healthcare workers across the country who are working under similar conditions. And I just wanted to thank everyone for having me at this meeting. And I hope to be, in communication about this struggle in the future.
Thank you very much, Katie, for your remarks, answering of the question and contributions. I think it's been, everyone will agree, has been not only insightful but critical to the discussion and demonstrating the universality of the experiences of workers, but also the way forward through the formation of rank and file committees. So on behalf of everyone here, thank you very much. And I know you have to go and get ready for work, so we'll say thank you. I will now call on Carolyn to speak from the Committee for Public Education, who is indicated. So I'll call on you, Carolyn. You should be able to speak now.
Thanks, Max. So I just want to extend the Committee for Public Education's greetings to those who are in the meeting, and I guess in particular the healthcare workers that are attending. I mean, fabulous contributions from both Katie and Jess, and of course Cheryl. So I just wanted to report a little bit about the work of the CFPE and just raise some of the things that have happened. So the CFPE is the Committee for Public Education. It was established by the Socialist Equality Party to fight for public education. And it, as such, is a rank and file committee. In an article on the World Socialist website this week, we noted that at least 6,888 students and 600 staff in Victorian schools had tested positive for COVID-19. In the first week back at school, 4,500 students and 800 staff tested positive. New South Wales has not made their numbers available, but in Queensland it's been announced that 1,150 student infections were recorded in a single 24-hour period earlier this week. All the states are working together, including the National Cabinet, to actively suppress information about infection rates in schools and the development of clusters associated with schools. Last year, the CFPE collected information about COVID cases into schools and reported them weekly, and this year we're doing the same thing. We're relying on parents and teachers and students to let us know if there are cases in their schools or workplaces, because this information is not being made available to workers and their families, and we believe that it is information that is needed in order to reveal what is really happening in the schools in relation to COVID. So in the 2 weeks since the new school year started here in Australia, we've had over 400 parents, teachers and students contact us to let us know that there are COVID cases in their schools. Some schools are reporting the development of clusters, 15, 20, 25 students or teachers coming down with COVID. Other schools are reporting that there have been COVID notifications that an infectious person has been at the school every day since school started. The infections are across all years at schools, with about 56% of them occurring in primary schools. The schools, of course, the primary schools being where the largely unvaccinated 5 to 12-year-olds go to school. The media claims that COVID does not affect children are conscious propaganda. In countries with large-scale COVID community transmission and open schools, such as the United States and England, children are dying every single day. Countless more are suffering from the debilitating effects of long COVID, with around 10% of all those who contract the virus suffering, including chronic fatigue, joint pain, and very complex neurological problems. In every country, the same class issues underlie the political establishment's drive to force open the schools in these dangerous conditions. It has nothing to do with a concern for children's learning or mental health. Our Prime Minister, Scott Morrison, has openly acknowledged that the real reason that students and teachers have been herded back into unsafe schools is to ensure that workers remain in their workplaces, continuing to generate profits for big business and finance capital. The teacher unions and their bureaucracies function as accomplices of this government and the ruling elite. Nowhere is this more clearly demonstrated than in their active support for the school reopening drive. The school reopening drive is a central part of the political establishment's push to force the population to learn to live with the virus, and it is consciously fought for by the union's leaderships. They remain the primary obstacle to building a movement of teachers and school workers against the criminal return to school agenda. And I guess that's also true of the universities as well. So the university teacher unions are also acting as a block in this. I noticed there was a comment in the chat earlier about not allowing teachers and educators to have forums. And this is one of the ways that opposition to the reopening agenda is being suppressed. Comments on union Facebook pages are being removed, and meetings that are held, people that the unions know are in opposition to the reopening agenda are just either are silenced in one form or another. From the outset of this pandemic, the teacher unions have collaborated with every government diktat, insisting that educators and school workers cannot under any circumstances develop their own independent position on the question of classroom safety and COVID. Union officials have also collaborated with governments in suppressing the data on the number of schools affected by COVID. The unions are now working to suppress the emergence of organised opposition. In South Australia, where 67% of teachers voted to strike, the bureaucracy has succeeded in subverting that vote through backroom discussions with the state government. In New South Wales, the Teachers Federation leadership has merely said it plans to closely monitor the situation when the schools reopen. Union officials have contemptuously ignored the outpouring of hostility with which this statement was met by the hundreds of teachers who spoke out on social media. And as I said, they've been blocked and had their comments removed. The CFPE is establishing rank and file committees to fight for a unified movement of teachers, parents and students against both the imposition of face-to-face teaching in unsafe conditions and the decades-long assault on the public education system. These committees must establish the closest connections with teachers around Australia and around the world who have entered into the struggle. Internationally, movements of educators include teachers who have taken strike across France, those in multiple American cities who have organised walkouts and sickouts, educators in Greece who have occupied dozens of schools to demand safe conditions and proper resources. Teachers, education support staff, students and their families need to develop the widest movement possible against the entire political establishment and turn out to other sections of the working class confronting similar attacks, like healthcare workers and other frontline workers. We need to fight for proper wages and conditions and resources to be able to do our jobs properly. But right now, more importantly, we need to fight against the let it rip policy and for an eradication of this virus. But in order to do that, we need to turn to a socialist and internationalist perspective. Many of the leading epidemiologists that the World Socialist website has interviewed have raised the fact that the pandemic is a global thing and it needs to be fought with a global, as a global, the fight needs to be global. We need to harness the enormous productive capacities and technological resources of the world economy in the interest of social needs, in the interest of health and public education, rather than the narrow interests of the wealthy few. So I do want to say that we support the nurses, but we do urge you to form rank and file committees, to break from the union, who are working very, very hard to atomise your struggle. And thank you very much for letting me speak.
Thanks, Carolyn. I think your comments really do highlight again the fact that teachers are being forced to work. I mean, really face the same experiences as nurses. Again, not only in terms of their health, but also in terms of the role of the union. And I think the action of the Committee for Public Education is critical in the development of rank and file committees for teachers to be able to protect themselves, their family and students. There has been a real important amount of discussion in the comments, and I will not be able to, in the time that allows, to get through them all. There have been questions, some I'll raise, we may not get to them, but I just want to encourage everybody here, anyone who's new, this might be your first meeting of ours, to give us your contact details. Get in contact with us through our email account, sep@sep.org.au. Sign up to receive our newsletter, among other things, because we want to continue this discussion. This is just the beginning in this meeting today. Just to quickly go through some of the questions, there is a question on the timing of the strike on Tuesday of the nurses. Is this politically motivated? Questions on how workers should proceed in forming rank and file committees. A question for, I think, Carolyn and the CFPE. Do you know for sure that public schools are offering a remote option? Do we know which ones? And also another question, I mean, where are the committees? We're not allowed to meet at work. I think, there are many points that come up in this and in the discussion. There's been, I think, some back and forth on experiences workers have been through, including Cheryl, whose husband is one who is at high risk, who's literally been asked to remove masks. Others who said that's not just his experience, that is in fact what is being requested of people, as well as not adequate PPE being supplied. I think there are some hands up and many points to be made. I will call on Mary, who's had her hand up for a while, to make a contribution. Mary, did you want to speak?
Thanks, Max. Just a couple of points. I wanted to tackle, there was a comment raised in the chat by Tammy Copley. Tammy says, a huge problem is that nurses and midwives do not stand together and unite. We rarely ever do. We kid ourselves by saying that we can't strike or speak up because our patients will suffer. That is a lie. They suffer more if we don't unify, speak out and strike. That doesn't matter if it's a union or any other group. Unions are only as strong as their members being active, just like anything else. I just wanted to, I really wanted to take that point on because I think it's the excuse that the union uses all the time for why they haven't taken action or led something or made a decision, or, you know, they'll often throw that back at the World Socialist website or anybody criticising them that, oh, well, you know, people don't agree with striking. Workers won't unite. Workers won't do it. They don't want to be militant. It's not us, it's the workers. They'll blame the working class for their own inactions, for their own policies. But what we've seen time and time again, look, Marx analysed and when the World Socialist website and the Socialist Equality Party are Marxists and understand that the working class is a revolutionary class, and the unions are there as part of the capitalist system to prop up, defend and support and protect capitalism, to defend capitalism and the interests of the capitalists against the working class in their struggles. And look, I just, the reason I wanted to raise this, I think it's very important because it's thrown back at workers all the time. You know, they're told that it's the fault of the working class that they won't fight. And it's just not true. In 1987, I attended the ACTU conference as a delegate from the Public Service Association, where I went also as a member of the Socialist Labour League at the time, the name of the Socialist Equality Party. And we intervened at that ACTU conference against a document and a policy called Australia Reconstructed, which the unions were adopting at that time. It was a tripartite agreement between government, business and the unions, basically to police the policies of the capitalist class within the working class, to ensure that the unions became this bastion of defence. Anyway, I opposed the adoption of the document on the floor of the conference, and I was thrown out by the PSA. The left-wing leadership of the PSA at the time were part of the group that agreed to the adoption of Australia Reconstructed, that were trying to push it through, Laurie Carmichael from the Communist Party of Australia, and they opposed, they couldn't abide any disagreement on the adoption of this document at the conference, and they threw me out, basically. We launched a campaign and fought that, but it was really something. It was really a very important demonstration for the working class that there was not one delegate, not one person at that entire conference who opposed me being thrown out, who opposed the undemocratic nature of that. And we warned at the time, these are the methods that the union is going to use against the entire working class. And we've been vindicated, you know, so many times in that assessment, because that's exactly what the unions are at the moment. They're the policemen for business and the banks within the working class. Workers put their hand up and call the union and say, you know, look, we need some action down here. If they say they're walking out, the union delegates down there in the union organizer will be down there in, you know, within minutes to control and make sure that that strike doesn't go ahead, that those workers don't walk out, that there's some agreement reached. So look, I think those are the points I just wanted to make. I think any conception that workers have, or that Tammy has, or anybody here thinks that workers won't stand together and fight, they're wrong. They're wrong. The Russian Revolution proved the revolutionary nature of the working class. And yeah, thanks, Max. Those were the points I wanted to make.
Yeah, thanks, Mary. I think that's an important historical experience of the role of the unions, particularly in their transformation into the kind of corporatist unions that we see today, that really has led to 30 years of social regression in this country and internationally. I mean, one point that has to be said about the hospitals is this situation has not just fallen from the sky as a result of COVID. This is a situation that has been, in that sense, prepared for, that is the disaster prepared for, through a 3-decade-long process of a war of attrition against the hospitals and against public health in general. You know, words that I'm sure nurses will understand: throughput, case mix, that is the focusing on moving people through beds, the payment of hospitals based on certain cases. I mean, this was the model that was utilised to transform and to reduce dramatically both the funding and resources for healthcare, and the unions have played a role in that throughout that whole period in suppressing strikes and isolating workers, which has created the conditions for today. Look, more can be said. There are other hands up, so I will call now on Terry Cook, founding member of the SEP, to speak.
I just wanted to agree with the comment by Tammy in regards to the position that was advanced by management. It's been taken up by Mary. Nurses should not take action because patients will suffer. Of course, this is emotional blackmail. And as you said, patients are suffering. Nurses are not responsible for deaths and suffering. This is the direct outcome of policies, as Comrade Shell and others have said, of the governments acting in the interest of the profit interest of the ruling class, both now in the pandemic, of course, which puts profits before health, and before in the concerted effort that's been carried out under Liberal and Labor governments and here and internationally to cut public health funding and dismantle public health. However, I think the question that was taken up, that the unions are only as strong as the activity of their members, and therefore the lack of activity by the working class means that the working class itself is to blame. I think this has to be put into much more historical context. I mean, the working class, the conditions that are now being dismantled, including public health and health conditions, were the outcome not of the generosity of the ruling classes. They were the outcome, as Cheryl said, of enormous struggles on the part of the working class, not only the countries overseas, but here in Australia. This capacity to fight, to take action, to take unified action, has been systematically dismantled and undermined by the conscious policies adopted by Labor and by the unions. The experience that Mary discussed was a general signal for a general assault on the working class. Under the Hawke-Keating government, through a policy of which was supported by the unions and carried out through the unions, a series of accords, the most militant sections of the working class were attacked. They were dismantled. They were smashed up. Workers who resisted this tripartite operation were blacklisted, were attacked, were driven out of the factories, both by consorted campaigns by management with the assistance of the unions. Organisations like the Builders Federation, not the Builders Federation, the BLF, were systematically broken, smashed, not because their leadership didn't kind of bend its knee to the accord, because contained in this section of workers were some of the most militant sections of workers who fought determinedly to change the conditions of builders, labourers on the building sites. Those some of the most oppressed sections of the working class. Then this was followed by another development, and this was carried out under the Keating government, where they introduced enterprise bargaining. Now, a lot of people who are in the unions, in the working class now, thinks enterprise bargaining has been with us forever. Well, it hasn't. The system of enterprise bargaining was consciously introduced by the Keating government. And it was introduced to put an end to unified national struggles by workers, to advance conditions, to defend wages, etc. It meant that any action taken outside of the very limited period, for a working agreement, a work agreement, could only be done basically on an enterprise by enterprise basis. This put an end to national strike action. It put an end to the unification of struggles across the working class. Workers were confined to limited action on their jobs or their enterprise. This served to fracture and break up the unity of the working class. And there were laws. Then, of course, we had further developments. We had a whole series of anti-strike laws, which were really, then codified under the Rudd government, the Rudd Labour government, when it introduced Fair Work. The Fair Work industrial laws, went even further. They outlawed any industrial action outside of the actual enterprise. And even then, they also introduced measures whereby both the Fair Work Commission and the government, under certain conditions, could intervene, close down strikes, and penalise workers for continuing action. The Keating government, of course, put an end to solidarity action, and this was then really codified even further in the Fair Work laws. So if workers, are not taking, are trying to break through this straitjacket, this disunity, these restrictions were placed on it by the unions. It is not the fault of the working class. In actual fact, now we're beginning to see the beginnings of a push back against this. And once again, every time something emerges, the union comes in, joins hands with the employers and the Fair Work Commission to, strangle, to straitjacket it, and to push it backwards. So it's wrong to say that workers, the union is only strong as the activity of its members. The union is opposed to any activity of its members that challenges the dictates of the profit system and the employers, or interferes with the position, with the privileged position of the union bureaucracy that acts as the political police force for the employers. So I think you're turning the situation on its head, and it robs, in that way, it cuts across the necessary perspective that has to be fought for. That is the development of new organisations of struggle. As we've seen, the development of rank and file committees, which are completely independent of the unions and will only emerge, and the fight, to resolve the situation that faces the working class will emerge in the form of an insurrection against the control of the unions and their labour accomplices. So I think that's necessary. I think the other aspect I want to take on was, as Cheryl said, the conditions of the working class were not the result of just the unions at one stage fighting for reforms. It was a result of determined struggles of the working class, particularly in the post-war period. I mean, the concessions, and I think we have to always understand this, concessions and reforms granted by capitalism, particularly in the post-war period, were not out of some, kindness of the heart. The concessions, in fact, were in response to save capitalism. They were concessions that were given, in response to the revolutionary movement of the working class that first showed and terrified capitalism in the Russian Revolution, and then in the immediate post-war period, the surge of struggles of a revolutionary nature that emerged, including the concessions that were given, included the provision of public health, which was not always, as workers think now, it's in their sight, that this is a right. It was established as a right, particularly in the post-war period. In other words, the truth is, what the unions fought for and the reforms that were granted were, for the union, were in order to keep the class struggle inside the acceptable framework of the profit system and never to challenge it. And they systematically understood that, and that's how it was utilized to prevent any real challenge to the capitalist system, which was really, and which was then and is now really overdue. In other words, Trotsky described it absolutely, correctly. He said that what was doled out to the working class in the form of reforms, etc., was the distribution of crumbs from the feast on the capitalist table in order to prevent workers from taking the entire products of their labour power. And that is how they've been utilised. And in that way, the world trade unions never represented the historical interest of the working class. The historical interest of the working class was the abolition of the of the profit system and the establishment of workers' power so that the resources of society can be utilised for the benefit of all. That is, the resources of society, which is the creation of the labour power of the working class, can be utilised for all. Now, we're still faced with this. We're faced with this very question. Now we're beginning to see, as one health worker said to me, he said, we are beginning to see what the pandemic has shown is the true face of capitalism. And that's what we're dealing with here. And that's why in this struggle for the formation of rank and file committees, that means workers begin to take the situation into their own hands. And they will only do this in complete opposition to the trade unions, to Labour, and to every other, apologist and agency of the capitalist system. I'll just leave it at that. Thank you.
Look, thanks, Terry, for those remarks and adding to the discussion. I think it is very clarifying and helpful. There are, just a plethora of discussion going on in chat. And for those who haven't looked, I would really encourage you to look. Some of the questions have been answered, both the question on private schools and remote learning, as well as a lot of discussion, I think critical discussion, on the role of the unions, both in the experiences of workers, including teachers, and then a kind of a grappling with the question of, well, what is the way forward? Is it the question of a construction of new unions, or there was one question, is it up to nurses, etc., to organise their own rank and file committees, or is there a way to do it through the SEP? I think that this question on the formation of rank and file committees, and in that sense, the role of the unions really gets to the heart of the discussion we've been having today. Comrade Cheryl has indicated that she will begin to answer that question and some of the other points that have been raised in the chat.
Thanks, Max. Look, first of all, I think that the avalanche of chats and comments in the chat is both very important, and if we haven't been able to get to everybody's comment, or if those who have indicated to speak we haven't been able to accommodate you, then please, accept our apologies. I mean, I think, in that sense, one of the reasons that we hold these meetings, and, we're holding this one today, but we've held many others. The CFPE holds them. The Australia Post Rank and File Committee holds meetings, is because there is no avenue which actually exists through any of the normal, the usual established organisations for workers to actually speak to each other, to understand what their experiences are. I mean, parents in many ways find out what is taking place in their school at the school gate. The school certainly rarely provides in-depth and timely information about the situation which exists in COVID. The same situation exists in health. I mean, the mechanism whereby workers are able to interact, to raise their opinions, to have those opinions either agreed with or challenged or clarified, I mean, that doesn't exist. And so, the fact that Tammy and others feel that they can raise what they feel, that they have another element of an appreciation of how the unions and other organisations work, it's very important. And we do thank you for your contributions. And of course, we have just as much right to raise our analysis and, in fact, the historical record, which I think the two speakers, Terry and Mary, highlighted and outlined. But of course, that's one of the reasons that we also fight for the formation of rank and file committees. I mean, and I'm not sure whether everybody who's in attendance at the meeting has had the opportunity to read some of the experiences that the auto workers, rank and file committees, the development of those struggles in the United States, that you've read their experiences, because one of the issues which they raise is that outside of the rank and file committees, which certainly the SEP assisted in forming, assisted them in both the discussions, the analysis, the development of statements, of letters informing the workers. And as workers said, without the rank and file committee, they would not have known what was happening in their struggles, the strike that they were organising. And so, when participants say, look, we can't have them at work, absolutely, it's very difficult. But you can do them, and we will assist. And we could organise rank and file committees, which included nurses, aged care workers. I mean, we haven't really even been able to broach the question of aged care, which is, I mean, to call aged care the killing fields is not an exaggeration. What is taking place in these facilities is not only heartbreaking, but it is a crime. It is a crime against those who are there, against their families. And of course, it is the expression, the sharpest expression of the attitude of capitalism to the older generation. These are, of course, the receptacle, the basis of which the experiences of the working class reside. The experiences that many of those in aged care facilities, of the war, of the struggles that they went through, the depression. Many of these experiences, young people don't even get taught them at school any longer. I mean, I can't remember the figure that was raised just recently. I mean, a huge percentage of young people who know nothing about the Holocaust. Is that a mistake by the education department? No, of course it's not. Because those experiences, of course, there are those for whom they are responsible. The issue of the Holocaust is, how could that take place? Who allowed it? What were the circumstances? And of course, that is not a discussion which capitalist governments want the younger generation to know about. And so the role of the rank and file committee is to organise, to actually be able to discuss so that people know what's taking place in different hospitals, in different healthcare facilities, what people think about them, how they think that the issue of safety, of the protection of both health workers, of patients, their families, is undertaken. And of course, it also means that health workers themselves have to take responsibility. They have to, in fact, take matters, into their own hands. If the constant search for somebody else who is going to do it, some other party which is going to do it, that is a conclusion which really needs to be, I think, dispensed with. The SEP will assist, will guide, will organise, will undertake this. We do it in conjunction with healthcare workers. And so anybody who wants to form or even discuss the formation of a rank and file committee, or who wants to have further discussions about the issues that are raised here, that the rank and file committee, I think there is a WSWS link which you can go to, and we will get the result of that, or there is an email address which I think is also in the chat for you to contact us, and we will contact you, and we will help organise and take responsibility for the organisation of a rank and file committee. And so I think that if there's conclusions being drawn that these matters are not for somebody else, but for those on this call, I think we have had a very successful and important meeting. Anyway, I'll just leave it at that. But I would urge anybody whose details we don't have to please give us your details. We want to, even if you don't agree, even if you want a further discussion, if you're not convinced, that's fine. We will discuss with you. So please give us your details, and we can continue the conversation and the discussion at another day.
Yeah, look, I really concur with Comrade Cheryl's comments. You will see in the chat there are a number of links that we've posted in getting in contact with us. Please utilise those. We will keep the chat up even at the conclusion of this meeting in order for you to get in contact with us. This is the beginning of the discussion. But with that, I would like to now appeal to everybody here today for a collection of the Socialist Equality Party's monthly fund and for the World Socialist website. On the screen, you will see how you can donate today. Now, if you're an Australian citizen, you will use the link that's at the top through the sep.org.au website. But if you're one of our international viewers, very welcomed international viewers, due to the laws, you'll have to donate to the World Socialist website instead, which you'll also see there. Every month, we raise our monthly fund, and it is entirely from the working class and young people. We don't get money from corporations or the state apparatus, nor would we accept it. I mean, it's raised entirely from our supporters. And we've met this monthly target for nearly 50 years, and the fund goes to the maintaining of our work on the World Socialist website, the running of our social media platforms, and the continuation of our work, including the fight for the formation of rank and file committees. But this work needs to be expanded, as we've discussed today, and for that we need resources. I mean, above all, to combat the lies and misinformation being spread about COVID, as well as the fight to turn to the working class more broadly, because it is our party alone that is calling for a socialist program to eliminate COVID-19. So I really appeal to you today. Click on the links that you'll see in chat, also on the screen, on the slides there. Make a donation today and let us know in the chat what you're donating. This is critical for the continuation of our work. These resources are used, as I said, for the expansion in various areas, including social media and on the World Socialist website. So while those donations are coming in, I would like to also make some announcements and some books and pamphlets that we have for sale, which is available through our website, Mearing Books, which is, we also have, in fact, an Australian website now, where you can get these books from, mearing.com.au. The first is the pamphlet, as you can see on the screen, entitled The Global Pandemic, the Class Struggle and the Tasks of the Socialist Equality Party. This contains the resolutions adopted at the 6th National Congress of the SEP in the United States. And it is an assessment up to that point of the development of the pandemic and the class struggle. And it contains our critical analysis of the pandemic as a world historic trigger event, which brought to the surface the underlying contradictions of the capitalist system and very much accelerated them, which has been, I think, central to the discussion we've had today. The next book is The Unfinished 20th Century. As you can see, that's $30 plus postage, or if you have a Kindle or EPUB, that's $13. I mean, this is a critical document, it's a critical book that contains a series of developed lectures from the party, above all, from David North, the chairman of the International Editorial Board of the World Socialist website. And the central thesis is, as you can see on the screen, that 100 years after the outbreak of the First World War and the Russian Revolution, none of the problems of the 20th century, the devastating wars, economic crises, social inequality, and the threat of dictatorship has been solved. In fact, they are posed ever more sharply today. Some of the critical chapters include a response to the end of history narrative that the liquidation of the Soviet Union by the Stalinist bureaucracy, the final betrayal of the October Revolution by this, this bureaucracy, was somehow the end of history, the short 20th century. Well, this, as we call it, post-Soviet school of historical falsification is tackled very directly. We also have chapters and lectures in the book on the role of the trade unions, tracing out historically their hostility to socialism and why and how, in that sense, they have, not only played the role of suppressing the working class, but in particular their transformation today, as well as attacks on the postmodernist view of history that all narratives are acceptable and that science is bunk. So I really encourage everybody here today to begin your Marxist library, purchase these books and begin a critical study of this history, because these essential lessons do need to be brought to bear in the struggles today. I do want to just draw your attention to another critical campaign that we've been waging, that is for electoral members. The SEP has continued a critical campaign against anti-democratic electoral laws, which themselves were rushed through the Australian Parliament on August 26th by the coalition, supported lockstep by the Labor government. Now, these laws target the SEP and 35 other political parties without seats in Parliament. They required the submission of a 1,500 membership list, treble the previous number, or face deregistration, which means that the party would lose the very right to field candidates under their party name on a ballot paper in an election. Now, these laws were passed at the height of the Delta variant in surge in this country, meaning that we were unable to campaign safely. This was the decision was made quite deliberately. Now you have a situation, and I think Comrade Cheryl went through this in her report, of a profound political crisis in this country, unprecedented, really, in many ways in scope and dimension. And so it's under these conditions that they seek to silence smaller parties, silence, what they would deem fringe parties, because it is those very so-called fringe parties that are gaining the lion's share of the vote. That is, workers are turning against the major parties who work in unison through the let it rip policy, and the destruction of the working conditions of the working class across the country. Whilst we have not met, the requirements of the AEC, we have submitted our list, and we did win significant numbers. And we've also, while we've been given a notice of intent to deregister our party by the AEC, we have responded to this, and this can be found on our website and will be posted in the chat. As we said in our response, this legislation is a naked attempt to prop up the existing parliamentary parties and stifle popular rising discontent, which is intensified by the disastrous handling of the COVID-19 pandemic. Now, our campaign is far from over and will continue up to and beyond the looming election, which will be called, has to be called by May, although there's no guarantee that will go ahead in the manner in which it has in the past. So we ask of you today, those who are not electoral members, sign up. Join our party in our fight against not only these anti-democratic laws, but the fight against the COVID-19 pandemic and the policy of letting it rip across the country. Just finally, we do make the appeal, and you can see on your screen the statement of principles of our party, which is $5. It is critical that everybody here consider making the most important decision of your life and join our party as full members of our party. The understanding and assimilation of the history of our movement, which is essential for membership, is contained in detail of our statement of principles. Again, I urge everyone today to purchase and study the statement of principles and consider making the most important decision of your life to join as full members of the Socialist Equality Party. So with that, I would like to again thank our speakers, Katie, Jess, and Cheryl, as well as the contributions, both in terms of the chat with the many detailed responses and thoughtful responses that came through, as well as from Mary and Terry. I think this has been a critical, important meeting. And as Cheryl said, this is the beginning of the conversation. We would like to have more discussions with you. Please get in contact with us and let's take this fight forward. So with those words, thank you very much for your attendance. I'll call the meeting closed.